everybody. This is Dr. Germanuel Landfair, an adult reconstruction specialist here at Orthopaedic Medical Group of Tampa Bay. And today I'm going to be talking to you about what happens at your preoperative appointment. Now, your preoperative appointment is a very important step in preparing you for surgery, and here's what you can expect. First, we're going to review all of your required testing, such as your EKG, your blood work, and any medical clearances that were necessary. Also, at your preoperative appointment, we'll be prescribing you a medication called mupirocin. This helps to protect against MRSA, which is a bacteria that can cause infections. You will be applying a bit of the cream to your nostrils twice daily, and this starts about 7 days before surgery. We'll also go over any necessary medical equipment, such as a walker, and make sure you have that ahead of time. We also have the opportunity to obtain helpful recovery tools, such as an ice machine or a TENS unit. Both of those things are very important and can help with the reduction of postoperative pain significantly. Your physical therapy referral will also be given to you, so you can schedule your therapy ahead of time. Let me repeat that, ahead of time, so you won't have any delays in your recovery. And also at this appointment, it's very important that if you have any questions for me that you have been waiting to ask, that's the most important time to tell me. So if anything does come up and we need to look into something a little more deeply, I can do that after that appointment before your surgery.